waiting for. Thank you. We are, while we await one of the panelists so that we can start early, I'll go ahead and introduce those who are here for now, and then we will start. Give me a minute. Yeah, just a minute. So, in no particular order, I'm going to introduce those who are on the panel. First of all, I have Dr. Rita Nubia. Dr. Rita is a pharmacist. She's a doctor of pharmacy, and she's also a hospital pharmacist and an entrepreneur. She has over 9 years experience. Let's welcome her. Dr. Rita, I think we'd like to see you, see your face if we can. You're welcome. Then we have Dr. Uche Amefuna Obasi. Rita, are you in the room with us?
Yes, I am.
Okay. Dr. Uche Amefuna Obasi is a medical doctor of 12 years duration. She's a psychologist. She's a career consultant. She also is an entrepreneur. She's a lecturer in a medical school, and she's all the way in St. Kitts and Nevis in the Caribbean. So we welcome Dr. Uche. Dr. Uche has said ahead that she may not be able to enable her camera, but her video, but she will be on the panel today. We are still awaiting Dr. Onifade, who will be joining us at some point. But as guest panelists, we also have in the house, we have MI, who may not enable her camera, but she's here. We can feel her here with us. And we also have CM Adeolu Akinyemi with us. Now, we're going to start. Like I said, there are a number of questions have been asked by different people. And the beauty of a time like this is that even if you were not the person who asked the question, listening to the answer will enrich your knowledge and your understanding about our products, about our business, and even about your health. And so I'm going to go straight into the questions and answers. And I also want to say, at some point, we will be taking, we might be able to take some questions from those of us who are here. So you're welcome. You're all very welcome. I don't know if we have any guests in the house tonight. If we have any guests, please, can you signify that you're a guest? And when you're typing in the chat box, please type to panelists and attendees so that we can see you, we can welcome you warmly. Now I'm going to go to the first question. Let me just share my screen. Just a minute. Okay, I don't think I'll be sharing. Just a minute. Okay. So, the first question that has come to us and that we shall be asking one of our panelists to answer for us is, it says, Please, what reader range can be used for stroke? What reader range can be used for stroke? And I'm going to stop sharing. And would Dr. Rita, perhaps you can answer that for us.
Okay. Good evening, everyone.
Good evening.
What reader range of products will be used or can be used for stroke? So for a person who has stroke or who has had stroke, it shows that the person has actually been diagnosed at the hospital, and most likely the person has been placed on some medications. I would also recommend that the person also take, if it's a male, the person can start off with the male hypertensive pack, or if a female, the person can start off with the female hypertensive pack with close monitoring as well, and preferably at low dose at the start off. And some lifestyle changes will also have to be involved, especially if the stroke was as a result of mismanagement. If the person is already a known hypertensive and later developed stroke, that means the person wasn't properly managed or was not taking the therapy as a due. Okay, people are complaining of volume. Can you hear me?
Not as much as before.
Wow. Okay, can you hear me now?
Yeah, it's a bit better now.
Better?
Yes, a bit better. Perhaps the house can, yes.
All right. So I was almost concluding. All right, let me go over it again. So I will be recommending the person takes the hypertensive pack alongside other medications that have been prescribed at the hospital. And the person also needs to start off with some lifestyle changes, because before a person gets stroke, especially if the person has been diagnosed with hypertension or any other health-related issue, it means the person has been on some other medications, but because they are not following the advice of their medical team and taking their therapy as a point due, they had the stroke. So lifestyle changes and the hypertensive pack is recommended. Thank you.
Thank you very much, Rita. Thank you for that. Yes, and just to add a bit, the hypertensive pack contains the Reader Bitters, the Reader Cleanser, and it has the company has put together a regime, a dosage and usage regime of these products, where it contains the bitters, the cleanser, and depending on whether the individual is a male or a female, at some point in the journey of using those products, the female would use Restore for women, or Fire for men. Also, because there's a possibility that the individual may have some muscular impairment, maybe some mild paralysis or weakness, you know, the balm could also help. The balm is also included in the male and female hypertensive pack. So thank you very much for that. So we'll go to the next question. The next question is, please, what reader products can be used by an 80-year-old man, 80-year-plus man that has carried out an operation on hernia for relief? So an 80-year-old man who has had a herniorrhaphy or a herniotomy, what can he use for relief? Dr. Uche, please, can we hear from you?
All right. Good evening, good afternoon, depending on where you are at. For the 80-year-old plus patient, I would recommend the Senior Citizens Pack for male, in addition to whatever take-home medication had been given to the patient. The Senior Citizens Pack contains the betas, which is very, very good for pain. And we also have Fire for Men. It's also very good because majorly for the elderly, the hernia would be, and since it's a male, the hernia will be inguinal hernia, and hence the Fire will be very good to help stabilize whatever it is. And the betas will do a very good job. You can also add the balm, because I've seen people have injuries, and by just applying the balm, and also the betas topically helped to heal the incision, that the cuts for the surgery. So it has proven to be very, very effective, ingesting it and also rubbing it on the incision directly. So just those, just the Senior Citizens Pack, and in addition, the rubbing of the betas topically and the use of balm will do a very good job in that situation. Thank you.
Thank you very much, Dr. Uche. It's so true. The bitters is very effective in different ways, not just taken orally, but topically. I remember a few days ago, maybe last week, I was cutting something in the kitchen and I sliced my finger and it started bleeding. And the first thing I thought of doing is I got cotton wool and put Rida bitters on it, and the bleeding was arrested. In fact, about an hour later, I forgot I had a cut. So the bitters is good, not just orally, but topically. So going forward, we have the third question. It says, please, which of the Rida range can I give to someone suffering from obesity, diabetes, and arthritis? A big combo: obesity, diabetes, and arthritis. Any of you can respond, and we would not mind if MI could help us out here.
Okay. Good evening, everyone.
Good evening.
Trying to enable my video, even though I'm using my phone. Okay, yeah. So for the person who is obese and is managing diabetes and arthritis, I guess, of course, borderline usually obesity comes with quite some baggage, right? Obesity would mean that the weight is a lot, so the impact on the joints and all would also affect and cause complications in terms of arthritis. So I mean, on top of my head, I will tell the person to go for the weight management pack. The weight management pack has sufficient combo to be able to help the person to take care of the weight, to take care even of the blood sugar, and then it has the balm as well, which can be applied to the areas that are really, really affected by the pains and arthritis. That's topically. So the weight management pack would be a very good start for the person to begin the 90-day plan. So that's what he has enough to kick the person started on that journey. And then, of course, when you're talking about obesity, most times you won't just address it with what you take in as far as supplements and all of that is concerned. I mean, for someone who has all of that, the person needs to have a lifestyle change. The person needs to have like an overhaul, right? So, and it requires portion control requires including more fruits and vegetables in the diet, then a lot of body movements, taking walks. I mean, it doesn't have to be anything too intense, because most times when people want to do things, they want to just go intense and be doing serious stuff, and then they give up. But, if you start with, 30 minutes walk in a day and you make it really constant, you will see the effect, on your health. So the weight management pack with a lifestyle change on diet, on, fitness, walk, body exercise would, in 3 months, person would see significant improvement on the health. And of course, not eating late. Those things are quite linked. So the weight management pack and then the lifestyle change would help.
Thank you very much for that, Emma. Yes, I believe that it's possible that once the person even addresses the obesity, the other ailments could disappear, just like you said. So thank you so much. At this point, I'm going to pause to welcome into the house Dr. Oladiran Onifade. Dr. Onifade, you're welcome. Dr. Onifade is a medical doctor, medical practitioner of 12 years, with 12 years experience. He works for the Lagos State Health Management Health Service Commission. He's a business coach. He's a holistic medicine advocate, and he's also a nation builder. So Dr. Onifade, you're welcome. Can we see you? Can we meet you? Thank you for joining us.
Thank you very much, Dr. Aino. Thank you so much. I'm happy to be here. Thank you, ma.
Great. So let's move on to the next question. Now, this is a long one, and I'll read it. It says, please, someone who has bile with anus coming out with blood in his stool has used the 90-day pack and even continued to use it over 6 months now. No more blood in his stools and no waist pain as well. But he still has his anus coming out when stooling, and he uses his hand to push it in. Not too big though. Should he apply the bitters topically on the anus, or what other reader recommendation? So thank you. Dr. Onifade, perhaps you can answer that question for us.
Okay. Can you hear me?
Yeah.
Yes, that's a very good question, because that's a very good question, and is something I would like to answer, because I've had some patients over the time. Because what you have just described is, we call all these things bile, but it's actually hemorrhoids.
Hemorrhoids, yeah.
So what you have described is actually called hemorrhoids. So with hemorrhoids, there are different described is a 3rd degree hemorrhoid.
Yeah. Okay.
Can you hear me now?
It's better now. Yeah.
Yes. So the one you describe is a 3rd degree hemorrhoid.
Yeah.
So with a 3rd degree hemorrhoid, it will not go back. It stays there. Even when you push it, it comes back. CM is telling me Ileya. Yes, it's Ileya mood. I'm actually somewhere to come and see my friend for Ileya. So it's Ileya mood. So that's what happened. It will not go back. The 1st degree, it might not even prolapse at all. It might not come out. With 2nd degree, you can still push it back and it goes back. But with 3rd degree, it stays there. There's nothing you can do. It stays there. So I've done something with our products that has been amazing to me, and I will explain so others can follow suit. We call something sitz bath when it gets to hemorrhoid. So what we will normally say with sitz bath is that when someone have a very painful or an hemorrhoid that is not going back, because apart from the hemorrhoid not going back, when it start coming like that, they will have a lot of pain. Then they are prone to infection. That thing that is coming out can get infected and it can give quite a lot of pain. So this is what I've done with our products. The cyst bath, you are supposed to do it with a lot.
We missed you.
Lot of salt. You put a lot of salt in warm. You put, can we still hear me, please?
Yeah,
Can you
it's
hear me?
breaking a bit. Yeah, we can hear you now. Yeah.
Okay, so I got a call. That's why it's breaking. Yeah, someone's trying to call me. So with hemorrhoid, with that third degree, and it comes down like that. This person don't want me alone. He keep calling me. I've tried to deactivate that call. So this is what I did. I put the salt. What you're supposed to do is to add salt. So I will put the salt. You put a lot of salt in warm water. So after putting that salt in warm water, what I've done is I add like 25 to 40 mils, depending on how severe it is. I add 25 to 40 mils of the Reader Bitter into that water. And the person now do cyst bath with it. Cyst bath means you sit on that water, let your buttocks touch that water, you sit on it, and you do that for about 30 minutes. It is magical. The person will have instant relief of the pain. And when the person tries to push it back, it stays for a while. But because it's third degree, once you get like that is not coming back, unfortunately, the person might now require
surgery.
It can give correct symptomatic relief. Complete symptomatic relief that might not come back again. In fact, someone joined this business because of this kind of issue. The hemorrhoid completely disappeared because we caught it at the first and second Reader Bitter 25 to 40 minutes to eat. The person is take the other one for cyst bath, and we have complete the hemorrhoid is completely gone. But at third degree, this person will most likely require a surgery at third degree because it has completely lost the muscular that holds it down. So even when you use this Reader Bitter at third degree, please, you need to see your general surgeon. There's going to be for a surgery at the third degree. But for second degree, your cyst bath, your analgesic plus Reader Bitters will do the magic. So that's the answer to that question.
Yeah, thank you. Thank you very much, Dr. Onifade. It's true. I mean, it gets to a point, sometimes we can't avoid surgery. There we are. So let me go to the next question. Now, I understand the capsule casings are made from gelatin, which is nowhere halal. Been taken up on this and thought to ask the doctors in the house. Gelatin is a no-no for Muslims, especially here in the UK. Are the capsules really made from gelatin? Please help me so I have the right explanations for my Muslim customers. Well, I think I can answer that, and I might call on MI to comment. And what I've been made to understand is that even we know it, our products have halal certification. Apparently the gelatin, there are different types of gelatin used in the casings of the capsules, animal origin and of plant origin. The one that is used for our own products have been approved, have halal certification. And as such, Muslims have no problems with using them. So that is the answer to that. And perhaps MI would like to comment a little further.
Yes, I think you have you've said it it's very apt and on point. Of course, the major reason why Muslims sometimes would have an issue with it is because animals are in different ranges. Sometimes some people use pork for their own gelatin casings. So but we got clearance on that. We even have access to the certificate which we're working on having, so that we can add to our documentations, so that even at the outsourcing level of getting materials or from other vendors, we can ensure that we're cleared globally for halal and for, so that. Okay, so the gelatins that we use are halal certified, and there's a certificate to that effect, which would make available on request. People need it to feel comfortable about what they're pushing. So I hope it's clear.
Yes, I'm sure it is. Thank you so much, Emma. You see, our company has gone to every end to make sure that what we have is acceptable globally to anyone. And so we have no barriers to recommending our products. Thank you very much, Emma. So the next question is, just a minute. Seems I've lost my. There's something happening. Okay, the next question, for some reason, I can't share the screen, but the question goes like this. It says, what type of reader products can be recommended for a woman who had fibroid surgery 2 months ago and wants to prevent a regrowth? She's in her 40s, but is not interested in giving birth again. So any of the panelists can answer that for us. Okay, I call on Rita. Please, can you respond to that for us?
Okay, good evening once again. Thank you for the question. Okay, for someone who has undergone fibroid surgery and is looking out for something that would be to help the person get better, I will be recommending the Female Wellness Pack. The Female Wellness Pack, the combination of Reader, Restore, and the cleanser for about 1 month. So the person talked about not wanting to get pregnant. If the person doesn't want to get pregnant, the person actually has to be proactive about it and involve themselves in getting a family planning schedule, something on family planning to prevent pregnancy, especially if they are sexually active. So Restore is also involved in improving the female health, the female reproductive health, and not only that, it has anti-fibroid properties, so it will help to prevent a reoccurrence of fibroid coming up. So I hope I've covered the question. So thank you very much.
Thank you, Dr. Rita. Yes, I mean, I've read that fibroids also, there's some evidence, there's some postulations that fibroids are also oxidative stress mediated or free radical mediated. And as such, if a person has had surgery for the fibroids, the Reader range is actually something very good to use in a bid to prevent the regrowth, because generally fibroids have the tendency to grow back even after surgery. So thank you very much, Rita. Let me go for the next question. The next question says, is recommending the fertility pack to someone diagnosed of adhesion who has tried IVF, which failed, a good idea? Rephrased, it says, is it a good idea to recommend the fertility pack to someone who has adhesions and who has a failed IVF attempt? Yeah, who would like to go for that?
Okay, I think I would like to go for that. Okay, so the problem here is adhesions. And I always say that when it comes to infertility, we need to actually investigate our patients or our clients, as the case may be, because a lot of factors cause this issue. Adhesions most of the times can be caused either because the person has had some procedure or surgery done before, or there's a degree of procedure that was done in the uterus, probably a D&C in the past, or incomplete abortion that was evacuated, or even some very severe form of infections. So those factors are what is responsible for the adhesion. And here we don't tell people to do what is not. If you have adhesion, there's something we call an adhesiolysis. Yeah. Adhesiolysis means you are breaking down the adhesion. And it's a very simple procedure. It's something that can be done in less than 15 minutes. So what you do in adhesiolysis is, through the vagina, you enter into the uterus. Adhesion means some things that make the uterus join together, or maybe the tubes. You now use a very simple instrument to remove those adhesions by just rubbing it inside and make it free. Because a womb that is not free, the sperm will not be able to pass through and go into the fallopian tube. Fertilization occurs at that side. If the sperm cannot pass through from the uterus into the fallopian tube, no matter what you do from morning till night, it's not going to achieve anything. So first thing is, if the person have an adhesion, it needs an adhesiolysis. The adhesion has to be separated to make the wound to be free. If you have done that, then I now mention something that a severe infection can do that. If what you are looking at, that we have done this adhesiolysis, there are still signs and symptoms of infection, you can actually combine your cleanser and your restore for this purpose, because there's a way this hormone stimulates the way the infection are being operated by the hormonal system in the body. And that does not mean you are going to throw the antibiotics they give you from the hospital away. No, don't. But you can combine that with your cleanser and your bitters and your restore as a recommended dose. But if there's an adhesion, this person will benefit from an adhesiolysis. If not, nothing is going to work. That's my submission on this.
Thank you very much, Dr. Onifade. That's on point. Yes, I always say that when infertility is due to a mechanical barrier, you know, there's something to be done. Either the barrier is removed, like what he said, or it's bypassed. So I've come across a number of people who have been suffering from infertility for a few years, and they have not had an HSG, which is a hysterosalpingogram. That's an X-ray of the womb to show the lining of the womb, to show whether the tubes are patent. If a person has been trying to have a baby for a while, that is one of the important investigations that needs to be done. But I don't know, there have been some people who 5 years, they haven't had an HSG. It's very important to have full investigation before we start treating. Thank you very much, Dr. Onifade. And I believe our attendees are listening and are learning. Now, the next one is, it says, And maybe Dr. Onifade can just continue his response, because this is in a similar line. Well, not exactly. It says, can I recommend cleanser and bitters for someone with fibroids in her fallopian tube, or do I have to add Restore? She's not trying to get pregnant.
Okay. Yes, I will respond to this. Can you hear me, ma?
Yes, we can hear you.
So the first notion I would like to correct with that question is you cannot have fibroid in your fallopian tube.
Yeah.
Yeah, that is a wrong, that's a wrong understanding of this subject. Yeah. You cannot have fibroid in your fallopian tube.
Yeah.
The only issues that can happen in the fallopian tube, they are basic. One is the fallopian tubes are blocked, which is diagnosed with an HSG. If they are blocked. Then another thing you can have there is, there are a lot of things that can block it. One of the commonest things that block fallopian tube is infection. Infection most of the time block fallopian tube or procedures, like I said. And with infection, of course, you can use your cleanser. You can use your bitter. But I still always say this. There's a procedure that is very, very close to HSG that can open up, yes, that can open up the uterus. So what they do in that procedure is that they push some things that contain some things that can chop those blockage in that tube. And you might need to do it 2 times, 3 times, 4 times before it works. So you need to do that. But when it comes to anything infection, of course, your cleanser is important. You have to bring your cleanser in. Even after that procedure, you should use your cleanser. Because some of this infection might not be something that is bacterial. It might be chlamydia. It might be anything. It might be any of all these fungi. It might be quite a lot of things that antibiotics basically would not clear. So yes, you can use your cleanser and your bitters to do that. But at the same time, this person we need for that fallopian tube to be opened. It has to be opened. It's just like the mechanical issue that Dr. Aina talked about. These things are very, very quite very key. When it comes to infertility, a deep understanding of the root cause is very, very important. Because if you don't understand the root cause, like yesterday, someone told me that one of my friends is trying to get pregnant, blah, blah. I said, okay, before I can say anything or prescribe any of our products to you, I need to interrogate this person. Because from the interrogation, I will know what are the likely things that could have gone wrong. Because if you just don't just tell you that I'm trying to get pregnant, they said my tube is blocked and blah, blah, and just say, go and use bitter, go and use this thing, go and use Restore. What if is something that is mechanical? So you need to have a deep understanding. You need to have a certain questions. We are always here. You can always let us know. We look at the question, okay, ask this person this, ask this person this, ask this person this, and we'll be able to advise you accordingly the things you should be able to do. So that is that about that.
Thank you very much, Dr. Onifade. Yes, I mean, we are here to point you in the right direction, depending on whatever the condition is. Interestingly, the next 2 questions are fertility related, and I'm going to read both of them so that maybe we can treat them at the same time. The first one is, it says, a client having fertility issues was placed on Rida Bitters Restore and Restore. Recently, I was informed that she went for fibroid surgical operation. What can she use after the surgery? The next one is, a client who was on fertility plan has completed the 90 days plan. She is not pregnant yet, so she asked if she should continue with the Restore and Bitters, or she should stop. I mean, even without reading these questions, Dr. Onifade's response to the last 1 or 2 questions, I believe has addressed some of this, but perhaps we can just shed some light on those specific questions again. So anyone can go for it. Dr. Uche can, Dr. Onifade, perhaps you want to continue. The floor is open for both of you or anybody else.
All right, so let me come in. For the first question of the lady had done fibroid surgery and wants to find out if what reader range of products she can continue on. She can continue on the female fertility pack even if she's not preparing to be pregnant, because women of 80 years plus, 100 years plus can still use Restore. So it's not necessarily only for getting pregnant. The only thing that will prevent you from getting pregnant is doing the normal surgical procedures or just taking some inhibitors like the use of condoms or every other type of OCPs. So for I would advise the person takes the female fertility pack or just the female wellness pack, because it still has the Restore, it still has the cleanser, and it also does have the betas. Then the second question that goes along the same side, which the person will still use the same range of products. The fertility pack will be very good. It's not magic. First and foremost, if the person wants to get pregnant, like Dr. Nifade has rightly said, you do the normal investigations to find out what exactly the problem is. And if after the investigation it's proven that both parties are fine, they keep using the range of products until she misses her period and she puts a stop to it. If not, she can still continue, it doesn't harm. It's a normal wellness lifestyle pack, and she can keep using those. Thank you.
Thank you very much, Dr. Uche. I would also like to add that if she's been, I want to assume that she has had full investigations, excuse me, before going on the fertility plan for 90 days. If she has, there may be a need for a review, maybe, excuse me, if the husband, for instance, had a seminal fluid analysis, if it was not okay, there could be a review, because if the person, if they have used this for 90 days, there should, maybe some of the investigations could be repeated to see whether there's any change. But it all goes back to the same, being fully and properly investigated. So the next, we're gradually drawing to the end of the questions we have here. Now, this one is something that possibly more than one person may contribute, or one person may contribute. My teammate sold bitters capsules to a customer. Below are her comments. I was feeling much pains on my back, and then it starts traveling from place to place in my body. I really felt uncomfortable with it. I think I bought it Thursday, 3rd June. Started that night as you advised. Didn't take it Friday because of the pains I was feeling. Took it again on Saturday night, and waking up on Sunday, I was feeling exactly the same way I felt on Friday. Please advise. So the floor is open for us to discuss or advise, or both.
Okay, let me advise on this. What you have described is probably, there are two things that could have happened. One, there might be a drug-drug interaction with that patient, that client. Then there can be an intrinsic personalized reaction from that patient. Intrinsic personalized reaction is not specific. Different people can react to any product, even anti-malaria, in different ways. So this person you have described might just have his own personalized reaction. It might be the bitters, we cannot ascertain, since we are not there to do any examination or test on this patient. So in such patient, what I'll say is that, one, did you take it raw or did you dilute it? If you take it raw and you didn't dilute, try to dilute it, let's see what happens. If the person has diluted it, leave a space of like maybe 2 to 3 weeks, then restart it again. It might be the first time this person is taking it, the body has been sensitized. Reactions happen a lot of time. Even the vaccine we are taking right now, people react to it different ways. So it can be a reaction from that after like 2 or 3 weeks, the body get used to it and such reaction don't happen anymore. Then if it's a drug-drug interaction, is this person on any particular drug? Is there any spacing between when he takes the drug and he takes the bitters? Those are things we need to know. If the spacing is not there, we advise on spacing. If the spacing is not adequate, we advise space it more, so that this one has run its course and this one now come and play its role. So those are the advice I'm going to give to that particular patient. There are a lot of other views that we can hear from other people on this. So that is my own view.
Thank you. Thank you very much. Does any other person, would Dr. Rita or MI has enabled her camera, and Dr. Rita as well may want to comment?
Okay, I think Dr. already addressed a number of things. I would have, of course, wanted to ask if the person was using other medications as well, which was not mentioned. There are some questions that are hanging. There are things that are hanging in there that we don't. So in advising or in making comments, we just assume certain things. So if the person was addressing one-on-one, one would have to send the person back to ask a couple of questions, while one tells the person, of course, to hold on. Based on the answers that the person gives, one would be able to advise appropriately. Then I think the person said the patient was using capsules, right?
I think so.
Yeah, I think so. Apart from
yes.
Apart from pausing use for some time, it's funny, but I think I've had 2 or 3 people who were more comfortable with using the bitters, who had reactions with the capsule, and then use the liquid, and it works well with their system. So that may also be another option out there that the person may want to explore, and of course to dilute it as well. I think these days it's even getting more. I think I'm getting a lot more comfortable with telling people to just dilute before use. Some people don't even tell you they have ulcer, or they have this or that, so maybe dilute, try the liquid, and dilute before use. So that's as much I can say with the information we have.
Thank you very much. Yes. Dr. Rita.
Okay.
Yeah.
Okay, thank you very much. I agree with everything that has been said, and I would just like to add, so many people forget that some other things that they take are also herbs, and it's clearly stated in our documents that it should not be used with other herbal supplements. So if you are taking the Reader range of products orally as a natural herbal supplement, do not take them with other herbal supplements. Dr. Biro talked about interaction. So yes, aside the conventional orthodox medication interacting, it can also interact with other herbal medications. And as regards those, MI talked about using liquid. Yes, I think that's the best option, and the person can start at the minimal dose. Even I think the children dose, the person can just start with 5 meals and just start and observe how they feel. And there are so many other questions to ask, like has been said. So I think I will stop there. Thank you.
Thank you very much, Dr. Rita, Emma, and Dr. Onifade for those responses to that. I mean, one thing, and I hope our attendees are gleaning this, that we need to be asking our clients a lot of questions, so that when we're escalating issues to any of the medical team, those questions have already been asked. I know that in the herbal medicine course, we talked about the questions that we need to ask, because the questions really will be the answers to some of those challenges. So now I'm going to our last question for today. It says, and I open it up to the whole panel, what products should I give a brother who has been diagnosed with some liver issues, including enlargement? So that's the question. What products should be given to a brother who has been diagnosed with liver issues, including liver enlargement, which we call hepatomegaly? So who would like to go for that?
On this. Okay, since this is the last question, let me just quickly contribute this. When it comes to anything liver at all, and this is the reason why the herbal medicine class is really very, very important for those that have not attended. Once you hear anything liver, the first thing that should come to your mind is the fat burner. The fat burner, because most of the things that cause issues in the liver has to do with cholesterol. And this fat burner is beautiful in reducing the bad cholesterol and increasing the good one. We have done a lot of trainings on this. We have done a lot of documentation on this, on why the fat burner is very, very good for anything liver. So once you hear liver, the person says he has hepatitis, the person says he has liver cirrhosis, the first thing that comes to your mind when there's a liver issue, the fat burner must come to your mind. And why? People add weight because the liver is not doing what it's supposed to do. And they get accumulated and turned to fat in the system, especially the bad cholesterol. And they just did not just manifest in the surface alone. They are already doing some intrinsic damage to the liver itself. So please, when you hear liver, the fat burner must come to your mind. It doesn't mean the person is going to lose weight, but it's going to do a lot in making the liver to go back to the way it works. The hepatocytes, those are the liver cells. There's a way this fat burner makes them to go back to the way they should perform optimally. That's that.
Thank you very much, Dr. Nifade, and I want to thank all the members of the panel. I'd like to thank all the attendees. I must say, and I believe you'll all agree with me, that we've had a very high-powered time today. I mean,
sorry, Ma, we have some questions in the question and answer room that we can quickly just answer.
Oh, okay.
And then there's someone raising up her hand as well. So
okay. Let me take the raised hand. Sorry, I didn't see the question. I was looking at the chat box. Okay. Let me take the questions in the question and answer room first. So to all the panelists, the first question here, it says, "Good evening. I assumed that fire for male and restore for female is only for fertility." So can any of the panelists respond to that for us?
okay, I would just like to just throw in a thought there. If anybody wants to just add something to it.
Yeah.
Like I usually like to share, right? What makes us either men or women are our hormonal makeup. That's really that's like the engine room of what makes us male and female. That's what makes the breast to come out, the hairs in the right place, the lactation when you should have it, menstruation when it should come, ejaculation when it should come. All the things that make us different genders is really around hormones. And when there's a slight malfunction, or when something is off there, it can present in different forms. So for example, and that's why in the cases of men, you would have, there's premature ejaculation, there's erectile dysfunction, there are prostate issues. I have someone that buzzed me yesterday, the husband did test and just discovered he had prostate issues. Okay, there are so many things that surround the hormonal makeup. When there's an imbalance in the hormonal makeup, either for male or female, then people experience manifest in different ways. So for male on one hand and for female on the other hand, of course, for female, you have hormonal imbalance that presents in so many ways. And it's interesting because even after giving birth, your hormones are not, they can decide to go another way. right? And when you're also approaching menopause, there's also what happens to your hormones as well. So what Restore actually does, and what the Fire for Men actually does as well, is to help the hormonal makeup, so to help the hormonal levels to be optimal, to be, the way they should, so that you can have, a healthy system, so that one is not riding the way it shouldn't, and all of that. So definitely it's supposed to make the body to be as it should be, so that it's performing optimally. So no, it's not only, and that's what happens. It's the reason why someone is not taking in is because the body is not like it should be.
Yeah.
Okay, so definitely Restore. I use Restore. I don't want to give birth again. I use Restore. Men use Fire for whatever reasons. As we grow older, we know the degenerative nature of the body. Okay, so the body needs help to go the way it should. So once you're over 40, I personally would say you should consider taking this supplement maybe once a quarter, just to ensure that the body is, so it's definitely not just for people who are trying to give birth. Definitely not. There's more to life than giving birth. Yeah.
Thank you very much, MI. Okay, let me take the next question. It says, please, I want to ask, what impact will someone who takes 2 Fire in the evening and 2 herbal capsule in the morning have? Because the person complained he didn't see any impact. Would somebody like to respond to that?
How long has the person used?
Yeah, that's the thing. There's a lot of the questions I would like to ask is, number one, how long has the person used it for? Number two, what impact are they expecting?
Exactly.
What is it that they use them for? But I don't know. It may be a function of the length of time. It takes time. That's why we recommend a 30-day a 90-day plan. And if the person has taken it for 2 weeks and hasn't seen, some will see it earlier, some will see it later. Yeah. Then the next question says, good evening. Can a lactating mother with a 10-month-old baby take Rida products?
Okay, good evening.
Good evening.
We already have it documented as well that a mother who is breastfeeding should not take Rida range of products until they discontinue breastfeeding. So she can only start up on Rida range, that's the oral range. After she has stopped breastfeeding, she can use the other products like the lifestyle products, the personal care products like the body wash, the body butter, the disinfectants, and so on. So those personal care products can be used. They are also good to help them remove the stretch marks and the other things that have affected the body during pregnancy. Thank you.
Thank you very much, Rita. Okay, we have somebody's hand up and we have a question in the chat box, and that's where we'll stop. Mrs. Flora Ikomi-Omorege, your hand is up. Would you like to type your question or, oh, okay, your hand is down. Maybe it was inadvertent. Okay, from the chat box, it says, what about someone who's trying to conceive and they've been using it since February and no pregnancy? They are taking Restore and Cleanser. They are 50 years plus, I believe. Well, I mean, I would like to say, first of all, that somehow that question may have been answered. But the thing is that, yeah, not all fertility issues will be solved. They need to do a medical checkup to find out where the needs and challenges are. And that is it. That's exactly what I was going to say. A checkup, they need to know, there must be a reason. The fact that they're 50 plus might mean they're already in menopause. Sadly, but that may be the case, and not that may reduce to the very minimum the possibility of a pregnancy. So I believe we have taken all the questions, and and I think that's where we'll draw the curtain on today. Thank you. It's been a very stimulating time, and we're going to be here again next month for the question and answer session. For next week, Wednesday, we're going to have another member of the medical team to give us the Wellness Wednesday talk next week. So thank you all very much. Have a wonderful evening and have a wonderful rest of the week. Take care and God bless. Thank you, Dr. Uche, Dr. Rita, CM, MI, Dr. Onifade has had to leave. Thank you all for being here and for supporting this question and answer session.